Importance of exercise. Regular exercise is a must. As we take bath, as we brush our teeth, with the same sincerity and regularly, one has to do exercise. Second is the diet control. Diet control need not be very, very strict, very, very preventive. But what you have to do is to have in terms of optimum diet, which is proper in terms of carbohydrate, protein, and fat ingredients, but also optimum in terms of total calories that you are consuming.
Welcome to 20th episode of Arogyam Katta. Today we have with us Dr. Anant Gore to talk about stress, sugar and survival. Dr. Anant Gore is a very senior physician and is ex-professor of LTMG, popularly known as Sion Hospital, and he's practicing in Chembur for probably close to half a century. Welcome, Dr. Anant Gore, on the Arogyam Katta. Tell me now, see, normally they say that body sends signals. Now, does body send signals before actually a heart attack occurs?
Most of the times we call it attack because it comes without any premonitory indications. However, some patients can have some premonitory symptoms like brief periods of chest pain, sweating, recent decrease in functional capacity, but most of the times it comes like a stroke. Suddenly the patient gets acute chest pain or acute cardiac disturbance and lands with an attack. There are premonitory symptoms are seen in certain situations like diabetes, where patient may not get chest pain, but he may get breathlessness, palpitation, feeling of suffocation as indicative symptoms.
Is there any quality of life after heart attack?
Yes, with present treatment lines available, the person can have life quality almost close to any normal person or what he was before getting an attack. Attack treatment has gone from milestone to milestone, from a masterly inactivity where people were bed rested up to 6 weeks because heart is an organ which has to recover while functioning. It cannot be rested like a bone which we put in a plaster and allow it to heal. Therefore, putting it minimum possible load just to be alive, so bed rested without any activity. From there, with the recent modes of treatments like angioplasty, even primary angioplasty, when patient comes with first 3 hours with chest pain, patients are almost close to their normal lifestyle. Advent of coronary bypass surgery has also made a big landmark and a big change in the future of these patients, where they can go back to their professional life, family life, and there is no limitation in their lifespan as well.
What are the common symptoms of heart trouble? I won't say attack, but trouble. I mean, that heart is not functioning the way it was functioning.
The commonest symptoms of cardiac dysfunction are shortness of breath, or we call medically breathlessness, particularly when you exert. The earliest is when you start climbing up the staircases, where the workload becomes 4 times than when you are at rest. And second thing is exhaustion, fatigue. Person is not able to carry on with the workload that he was doing before. Third thing, patient may get disturbance during sleep, like sudden feeling of suffocation, sudden breathlessness and sweating, what we call as paroxysmal nocturnal breathlessness, which is a definite indicator of cardiac dysfunction. Plus, they can get giddiness, they can get uh, chest congestion, cough. They can also get swelling on the legs when the cardiac dysfunction becomes chronic.
How harmful is stress?
Stress is uniformly harmful to the body. It's not only harmful for heart, but it is harmful for all the systems. And it acts in many ways. And not only that, it deteriorates your cardiac function, but it can deteriorate even the comorbidities, what we call like pro-existing problems like diabetes, hypertension. If you have any psychological problems, then stress can definitely aggravate it.
Can heart patients do exercises?
Heart patients, after they recover from the heart attack or the primary event, they can do exercise, but that exercise is of two folds. See, like when we do for anything, you have to set down your targets. And here the target is A, rehabilitation, and B, increasing his aerobic capacity, and not try to achieve the athletic standard. So within the framework that a person is given, he can do exercise. And the commonest thing that we do exercise are the walking. Walking is the best form of exercise that the heart patients can do. And when he's completely recovered, about 30 to 40 minutes brisk walking with whatever brisk speed he can walk per day, and at least 4 days in a week, preferably all the days in a week, is what is a very good exercise for any person who has recovered from heart attack.
Are there any changes with time or improvements with time on the treatment of heart attack? Maybe medicines are the same old medicines or newer medicines with newer composition have come in the market?
Medicines, yes, definitely there are medicines which are given to increase the blood supply to the ailing cardiac muscle. Medicines which are given to optimize the oxygen consumption in the heart and the function in the heart. Medicines which are given to control the comorbidities, basically metabolic problems like blood sugar, cholesterol or lipids, which make patient vulnerable for heart attack, or hypertension, which puts extra workload on the heart. So these are the medicines which are targeted to the heart attack. We have certain procedures which are done to improve the vascularity of the heart, namely angioplasty and bypass surgery. In angioplasty, they go with a catheter inside, remove the block, and in order to prevent the vessel collapsing, they put a stent. And therefore, a blood supply to the heart muscle, which is ailing, is restored, and it is saved from getting necrose or what we call a cell death. And that really helps the patient maintain in time. And now, in fact, what is best in the interest of the patient is primary angioplasty, that that is done provided the patient comes in first 3 to 4 hours after starting the chest pain or first symptom of heart attack, where there is a emergency angiography done, and whatever the block is seen is bypassed or taken care of, and a stent is put. So there are another medicines which are also used concomitantly, like antiplatelet drugs and medicines to prevent clotting, because there is a big chance of reclotting when they put this stent. And in order to prevent stent thrombosis or stent getting blocked, there are medicines which are used. Now, after the patient recovers as well, this patient has to have certain follow-up treatment, essentially consisting of medicines for blood pressure, medicines for diabetes, medicines for controlling cholesterol, and blood thinners. These are the main medicines that this patient require to take.
Sometime back, I had read somewhere about chelation theory, ultimate solution to the heart problem or heart attack or whatever. But I don't see it growing anytime. What is that chelation theory and What's your take on that?
Chelation theory was a concept which was introduced whereby you give a chelating agent and sort of clean your blood vessel tree. The vascular tree is supposed to be cleaned, and therefore, whatever the changes because of atherosclerosis or hardening of the vessels due to cholesterol, etc., have taken place, they are presumed to be removed. Presumed to be, I say removed. However, in order to practice it on a routine scale, we have to have evidence. And there has to be a randomized controlled study with a definite proof that this method is better than the existing method or at least as good as existing method. And such randomized studies are not available with chelation therapy. That's why it is not used on a routine scale. Still, it is in an experimental state.
But I'm talking about 20 years back. I had heard about chelation theory, maybe little 5 years here and there. So I think enough time has passed for a medical fraternity to look at chelation theory seriously, or because
Question is that once we had angiography, angioplasty, and coronary artery bypass surgery, it definitely scores over any sort of surrogate methods like chelation therapy. Maybe there is a small advantage that you will have advantage at all over the body if you do a chelation therapy. But we still do not know because since we don't have evidence.
have you heard about any adverse, at least adverse reaction to that, or adverse, or
No,
neutral?
there is no, at least I have not come across any literature stating adverse reaction to this therapy.
Okay, now let's turn to diabetes. What is diabetes? I mean, we hear the word diabetes everywhere, but we don't know what it. We only know is that sugar is prohibited in diabetes, but I'm sure there is much deeper than that. Can you explain diabetes in briefly?
First, I'll say what is diabetes in scientific terms.
Can we?
We feel there's a deficient action of insulin, either because insulin is absent or and insulin is not effective. I have avoided a very long scientific definition of diabetes, which runs into 4 or 5 lines. But on a broad scale, diabetes is of two types. In the first case, insulin is absent or deficient. There, usually the diabetes starts much earlier in life. Type 1 diabetes, what is it called as, starts usually in the childhood. Sometimes we see these type 1 diabetes in the adulthood. But I would say in India, about 98.5% of the diabetes is type 2 diabetes. In type 2 diabetes, you have enough insulin in the body, but it is not effective, or in other words, it is what we call as insulin resistance. And that's why the effect is blood sugar rise, and that is commonly called as diabetes.
Now, this insulin resistance, how does one counter that? I mean, what are they say? Or is it the same treatment of diabetes, or insulin resistance need to be looked at differently?
There are um, studies, experiments, research going on, and there are treatments available which were targeted to improve the insulin resistance. And the best thing to improve insulin resistance is exercise. Okay. Exercise is the only modality where you can consume your sugar without the help of insulin. Not only that, insulin action, when we say resistance, is at 3 levels. One is at muscle level, secondly, it is at liver level. These are the two main sites where the insulin action is required, and these both are helped by regular exercise. Insulin action, what we use medicines, one group of medicine which is called sulfonylureas, these tablets, they increase the insulin secretion inside the body, so the total insulin effect increases. The another drugs, they act at liver level and they what we convert what is called as pro-insulin to insulin, which is this active form. So in other words, they improve the insulin action in the body. Whereas in patients where these things do not act or are not able to control blood sugar, we use insulin per se as a replacement therapy. So then the patient has to take it in injectable form, maybe once a day, twice a day, or even at times 3 times a day to control his blood sugar.
What are key diet tips for diabetic? Diet tips for diabetics? Because in India we are no country. I mean, in the sense, for anything you say, don't do this, don't do this, don't do that, don't eat this, don't do that. Now, nobody tells what you should eat and what you should not eat. So, can you tell us briefly about what should be the diet balancing for diabetic?
See, essentially, what one has to cut down is the sugar intake.
Okay.
Sugar in net form, which is a quick sugar, like cane sugar. If we put it in water and drink, or if you eat something which is sweet like mithai, then quickly it will go into your blood and raise the blood sugar. But there are other sugar is also present in another form like polysaccharide form, and these are called as complex sugars. And if you eat these complex sugars, they do not raise your blood sugar. However, the consumption of net sugar or quick sugars is definitely not recommended for diabetics, but the complex carbohydrates can be consumed by a diabetic. Essentially, pure carbs like maida are not preferred for diabetes. High fiber, high vegetable fiber diet is what is recommended, and therefore what we our rural India used to eat before, that is millets like your jowar, bajra, nachni, ragi, wari, all these things are extremely good for diabetes because they give protein plus they are very rich in vegetable fibers and they will not raise one's blood sugar. Similarly, fruits. The question is, fruits also contain complex carbohydrates, but they are also sweet. Now, what happens is if you make a juice out of it, filter it, and drink it, it is only sugar solution. It will quickly increase your blood sugar. But if you eat the fruit with the pulp, then it becomes a complex carbohydrate because it contains peptidoglycans, which are complex carbohydrates, and they in fact retard the absorption of sugar, cholesterol, etc. in your intestine. So it is healthy to eat fruits, though they taste sweet, and though not to have fruit juices, particularly the filtered ones.
One tip for a healthy lifestyle.
Most important thing what is bothering the world right now is the obesity. Obesity is a pandemic, and obesity in simple terms means excess weight, and that is something is to be avoided. And ideally, the start should be in the childhood. Most of the time, the children are pampered and they are fired with all sorts of things, and childhood obesity is a very, very common thing, and it is now well known that childhood obesity gives rise to adulthood obesity. Malnutrition in childhood also is known to give rise to obesity in adulthood. So, proper control of diet, optimum diet consumption since childhood is the best way to prevent diabetes. During adulthood, regular exercise, optimum caloric intake, and maintaining proper lifestyle. Avoiding dangerous habits like particularly smoking or tobacco in any form is extremely important. Consumption of alcohol up to a limit, what I call 2 by 2, that is not more than 2 drinks at a time, not more than twice a week. If you are in that limits, okay, that can we look other way. But anything beyond that, at one sitting or even multiple sitting, can be toxic in the long run.
I'll ask you a question, which is for a specific person. You may opt to not to answer also. Like his sugar at 10 p.m. was 180, at 3 a.m. was 140, and 7 a.m. was 220. How do you explain this? Because between 3 a.m. and 7 a.m., nothing was consumed, nothing was taken, not even a water, maybe half a glass of water.
There are various possibilities in this scenario. A, if the person is having medicine before dinner, previous night, and that is acting for about 8 to 10 hours, then the action of that medicine is not sufficient to control morning sugar. There is something called as redistribution effect, that when you take a medicine, it goes all the levels in the body and gets accumulated in the fats. And then after some time, when the blood level of that medicine goes down, the medicine which is there in the adipose tissue or fats comes back in the circulation and starts having its effect, and the sugar can go down. And the third thing is what is called a down effect in diabetes, which is a well-known feature that you can get low sugar in the early morning hours because of this dawn effect.
Okay. What is dawn effect?
Dawn effect is seen in patients who are taking either a intermediate acting or long acting insulin as well as tablets. And the effect of what I mentioned with a little difference of than what I mentioned just now, that either the action is not sufficient or there is a redistribution phenomenon, what we call it, and that's why the action is enhanced, and that's why and the sugar goes down in early morning hours like 4 a.m.
How dangerous is it for a human life?
If it goes to lower levels, anything less than 70, it can be dangerous. If it is coming down to 140 or 120, it is not dangerous. In fact, at that time, a level of 100 plus minus 10 will be the best level, I would say.
Thank you for coming on Arogyam Katta. Do you want to say anything on your own? Because we would have missed a few interesting topics or few important topics, which as a doctor, because you must be facing everyday patients and host of questions from them. So, which are the most common questions which are not been covered so far?
Importance of exercise. Regular exercise is a must. As we take bath, as we brush our teeth, with the same sincerity and regularly, one has to do exercise. Second is the diet control. Diet control need not be very, very strict, very, very preventive, but what you have to do is to have in terms of optimum diet, which is proper in terms of carbohydrate, protein, and fat ingredients, but also optimum in terms of total calories that you are consuming. If you are exercising every day, then one can have little bit of allowances on either side. But proper food intake and proper exercise, avoidance of bad habits, particularly smoking or tobacco to any form, I think is the best way to of our life.
I see. Now, thanks for answering all the questions. We have almost come to an end of the podcast. I would ask you if you, I'll make some statements, answers of which will be either yes, no, right, wrong, or one sentence or two sentences at the most. Stress affects the heart.
Yes, in many ways.
Heart attacks are more common in winter.
Yes, because of the high sympathetic surge. Sympathetic and parasympathetic are the two branches of autonomic nervous system.
Okay.
And in sympathetic surge, when you are exposed to cold, this will happen particularly when person is exposed to that cold climate. The sympathetic surge occurs, which quickens your heart rate, which also increases your blood pressure, and these are that is one of the things which can make one vulnerable for precipitation of heart attack.
Walking alone can improve heart health.
Yes,
Smoking is worse than alcohol for the heart.
very much.
Poor sleep triggers heart problems.
Yes, it can.
Women experience heart attacks differently.
Little differently. They may not get classical chest pain, but they get pain in the throat or backache in the middle of the back, or they come to you with breathlessness and straight away signs of failure like froth at mouth, or they can also get burning pain rather than acute chest pain, what usually is the commonest presentation.
Diabetes can be reversed.
Diabetes cannot be reversed as of today. There are things which are going on. They are doing operative treatment for diabetes like gastric sleeve surgery, where the sugar normalizes, and this claim that it is cure for diabetes. But diabetes, once you are diabetes, you are always a diabetic. You are controlled or uncontrolled. So controlled diabetic doesn't mean that diabetes is gone. If
So
you are
sleeping.
sorry,
It's only sleeping.
it should know it is under control. The things are controlled. You avoid the bad effects due to diabetes, but still you are a diabetic. If you take off those controls, you will become frank diabetic again.
Type 1 diabetes is preventable.
Um, I don't think so.
Diabetics should eat small, frequent meals.
No, they have to have an optimum small breakfast, proportionate lunch, and proportionate dinner.
Sugar substitutes are harmful.
The older ones available were cyclamates, which were carcinogenic. So they were claimed to be make you more prone for certain cancers. But what are available today are not harmful, but they can increase your weight. And it's not that you can take any amount.
Obesity is always linked to diabetes.
Yes,
Dehydration worsens diabetes.
yes,
Stress alone can raise blood sugar levels.
yes,
Diabetes should avoid fruits entirely.
not necessarily. They can eat fruits, as I mentioned in my previous presentation, that they should eat fruits and not take fruit juices. And one more factor is that it is preferable to eat the fruit with the skin on wherever possible, like apple, peru, chiku, rather than peeling off everything, as it occurs in nature, because that skin also has a lot of vegetable fiber and that is very healthy.
Blood pressure is genetics.
Yes,
Yoga corrects blood pressure.
yoga can make it less severe. It cannot correct it totally because yoga essentially conditions the autonomic nervous system, and that's why it is a very good adjuvant as towards the treatment of hypertension.
Frequent health checkups are essential for healthy people.
Depends what is your age and what are your comorbidities. If somebody is already having a cardiac problem, diabetes, hypertension, it is preferred that he has his test done, follows with his doctor at least once in 4 months. A normal person, everybody should have at least a full medical checkup when he crosses 40 years of age. And if there is anything positive found, like high cholesterol level, high blood sugar level, then that should be in its own way. Everything has its own recommendations, like cholesterol. You may do once in a year. That is more than enough.
Fasting is good for heart patients.
No, absolute fasting is not good for heart patients because by chance if the sugar goes down, they can precipitate a heart attack.
Heart disease is common amongst young people nowadays.
Yes, very much common in younger age groups. A, because of the social stress, financial stress, family stress, personal stress, which is definitely higher. Quite a few of them are eating indiscriminately. Basically, the western side of food, like cheese and other things, saturated fats, which are going in larger amounts. So that can be harmful if it is done without any control. And heredity, especially if the heart disease is there in the family, then the younger next generation is definitely more vulnerable for heart disease. Considering all these things, suppose both the one parent is having problem like diabetes or hypertension, there is a 40% chance that the child will get diabetes. If both the parents are having diabetes, then there is a 90% chance that the person becomes diabetic. But it is sort of a seed and soil theory. It gives you vulnerability. But such a person keeps controlling diet right since beginning, moderates his weight to a proper percentile form, he is temperate in habits, and does regular exercise, he can avoid becoming frank diabetic. But all these things come under a broad heading called pre-diabetes. So that person will continue to be pre-diabetic and will not become a frank diabetic.
Last question. This is a question. For what is the correct weight with reference to height?
To a layman, let me just tell you.
Rule.
Sorry?
Rule.
Rule of thumb for a layman is height in inches, same number of kilograms.
Okay.
That's a very, very simple way. And it's very close to scientific way.
Okay.
So once, if somebody is say 5 feet in height, 60 should be his weight.
Right. Thank you for answering all the questions, and thank you again for coming on Arogyam Katta.
It was my pleasure. I really enjoyed questions from you, and they were very, very. They should be informative to everybody.
Thank you.
अगर आपको ये वीडियो पसंद आया हो तो चैनल को सब्सक्राइब करें और लाइक करना ना भूलें। अगर आप किसी विषय पर और जानकारी चाहते हैं तो कमेंट में लिखें ताकि हम आपकी पसंद की वीडियो बना सकें।